Hey guys, I just had my SMA Syndrome surgery today, so if you'd like to watch my video to follow the journey of me having surgery and how I recover afterwards, then please keep on watching. Hi guys, reality. See, this is what I usually look like most days. I said in my previous video that I was going to vlog the SMA Syndrome surgery that I will be having on Monday. Today is Thursday. So I suppose I'll vlog a little bit leading up to that, but generally this is my days. I don't have really any energy, and I've been like that for a good couple of years, quite many years. It's just gotten worse since the gastroparesis and losing so much weight. But yeah, the doctor said that it's a 50-50 chance with the surgery. He's not doing the duodenostomy. He's not doing that. He's doing a little, like a procedure that's a little bit less invasive. But I mean, I had all these symptoms prior to developing SMA Syndrome, which is superior mesenteric artery syndrome, where the fat pad sort of goes, usually from weight loss, and then the arteries are no longer like that. They're like that, and they're squashing the duodenum in between. So yeah, I mean, it may help that problem, but it's not going to be taking away any of the symptoms, I don't think, that I get, because I've been getting them now for a very long time, and I think I've only had SMA syndrome for the last 2 months or so, I think. So today I've just got a really shitful bad headache. Got a hot pack on my belly, and I'm nervous, but I'll be looking forward to surgery in a couple of days. So I'll check in another time prior. Okay, bye. Bye guys. Tomorrow, surgery day. So let's get packed. So I'll actually be staying at my parents' tonight, so my dad can take me. My husband's having the day off, but yes, I've just got things packed because I don't know how many days I'm going to be in there. So I've got my meds, I've got swab to check to make sure I don't have COVID in the morning before, Difflam for my throat, some other lollies, bits and pieces, tops, undies and socks, shampoo, pants that I they're casual pants, but I wear them to bed, and a massive blanket my mum made me to go over, plus all my other things like tapes. Hot pack is a must, my pencil case, feeds, I've got all my chargers there for phone and feeding pump, I've got my feeding backpack and getting sets, and that is about it. But I will speak to you later or in the morning.
Hi guys, I think I spoke to you earlier. It's still surgery day, as in like I had the surgery earlier today, and I'm up in a ward now, and we don't know how many days I'll be in here for. Most of these patients go home on after the first night, but because I have POTS, we're erring on the side of, just safety-wise, because of my POTS and passing out. But originally, pain-wise, we discussed it and agreed that my pylexia would be fine, but he would up the dose a little bit more, and he would add in Celebrex, like an anti-inflammatory, and Lyrica, and then when it came to recovery, obviously he comes in and out and checks on patients all the time that he's dealt with, and to give pain management sort of stuff. Well, he came out and I heard him look at me. Mind you, I had fentanyl first, multiple doses, and then they gave me ketamine, which made me high as a kite. Like, I felt like I was flying on a magic carpet or something. It was weird. I didn't like it, and when that cooled down a bit and I was a bit more not sedated, he said, look, you've got too much pain to just have pylexia, and he said to the nurse, I want you to go and get a PCA set up with some fentanyl. So I have that every 5 minutes. Where's the buzzer? Here, every 5 minutes. So, that was, it's just, he's really, really sore, and I've had a lot of laparoscopies, and they've all been okay. They just feel like you've done a lot of sit-ups. But this one, and I've also had an open, what was it, appendectomy and an open hysterectomy, and this shit's all over them. This is horrendous, and I said that to the nurse because I don't want them to think I'm a baby, because I've got a really strong or high pain tolerance, and I said, this is the worst I've felt, and she said, I know, because every person that comes in here says how bad it is, and she said, I've had patients that have had heart surgery that then come in years later to have gastro surgery, and they say that their bowel or stomach surgery is way worse pain-wise than the GI system, more painful than the heart attack, sorry, or the heart surgery. So that has to say something, but yeah, I'll see how I am tomorrow, and I'll let you know how all is rolling. But at the moment, I've just done a lot of pylexia, and I can have endone. I'm a lot on, I'm getting confused, a lot of, fentanyl, and some pylexia when I wanted, and my normal meds. But I'll check in tomorrow with you all. Good night. So, what do you do when you wake up at like 4 to 3 in the morning or something ridiculous like that. Like I haven't slept for pretty much 2 full straight days, yesterday and the day before, like the night. So first thing I'm going to do is press my PCA pain relief, which is fentanyl. Tops. Then what else do I do? Cut face tape to the size and shape that I like into different colours. That's it. And then I had to have a coffee because my throat is sore because the 10 French that I had and have had for however long has stiffened, but he didn't want to replace it because he said you need to hold out as long as you possibly can. Otherwise, yeah, he'll push. If I push it too much, he'll push for a surgical tube at this point, and I'm not quite ready for that. But yeah, I still obviously haven't seen him because it's just in the middle of the night of the operation. So technically it's tomorrow. But anyway, yeah, I'm feeling quite a bit of pain. My whole rib cage feels like I've been beaten up or been in a car accident, and it's really, really sore. And going for now and cut a few more tapes and then hopefully try and get some sleep again, but I doubt I'll be able to. So I will sleep tomorrow, which is technically today, but later on. So see you later. Hey, checking in again for, I don't know how many times I've done this so far for this particular video. It is Wednesday. I had my SMA Syndrome surgery on Monday. I'm a little bit more, or quite a bit more, aware of my surroundings than when I saw you last time, which I don't know whether it was yesterday or the night of surgery, I can't remember. But yeah, I have my trusty hot pack. They've got me on some painkillers, but you know what, I've had laparoscopies before and they've never been so painful. And I spoke to one of the nurses and said that because my doctor said, oh, well, it was the least invasive, and I already knew that, but I haven't gotten out of bed yet. I still have the catheter in, but they do want me to get out and try and walk today. So yeah, I'll see where I'm at this afternoon and I will check back in with you guys. See you later.
Hey, me again. I didn't really video much in the hospital. I did a video and started watching it, and I may add a little bit of it, but I was off my dial and couldn't talk properly from the meds that they gave me. But the surgery's done, SMAS surgeries, or the SMA Syndrome surgery for the compressed duodenum blockage. And I'll remind you, SMA syndrome is superior mesenteric artery syndrome, and it's rare, just as gastroparesis is, and it's unfortunately a complication that just arises when you have gastroparesis or any motility dysfunctional disorders. Yeah, so my severe weight loss caused that. I haven't had my post-op check with my doctor yet, and funnily, when I was in hospital, I didn't even ask him what he did or how the surgery went, and I think it was because he was in there for such a short period of time that there were other things I needed to discuss with him. But it was literally when he would check in, it was like for 5 minutes, so I didn't get to say all that much. There were 4 little cuts done that were only about that big, and one of them that's right underneath my rib, like on my left side, they're all tender obviously, and I've had a lot of laparoscopies before, but one of the cuts directly under my rib, and I think it's because it's happened because when I stand up and lean forward, because I've lost so much weight, it's not like a big chunk of flesh that someone might have if they've lost excessive weight when they've had stomach surgery. It's not like that. It's more like a really soft, wrinkly, you could probably say a 90-year-old's hairless scrotum. But when I stand up, you can see that. But when I was laying flat, or when I lay flat, like on the operating table, my stomach would have been completely taut, so my doctor wouldn't have seen that that's what my skin looks like. But I don't know whether it's a stitch inside or what, but the video that you will see that I will add, when I don't tense my stomach, the muscles there, it looks normal. As soon as I tense it, it puckers up and pulls upways, and it's pulling from the inside. Like it feels like whatever's on the inside of my abdominal wall is attached to something. So this little cut right underneath my ribs is the only one that's doing this, but when I breathe and tense my muscles like this, it gets pulled upways. It's so weird, and it feels like it's connected to something. This cut, and I'm not sure, so when I do see him eventually, I sent him a photo and he said that should go back to normal. I don't think it will, because the other one on the opposite side in the same sort of spot isn't doing that. So he'll get to see that when I do see him. And I was going to, so when he went in there, he said that there was a lot of scar tissue and adhesions, so I'm assuming that's from previous surgeries. And when I did have my hysterectomy at 33, I wasn't aware at that time, but since then my obstetrician gyno had said that I did have adhesions and stuff on my ovaries and in certain areas, so I don't know whether that's going to be a complication of this surgery now, whether more scar tissue is going to cause some issues. But I'm home. I've had a migraine for 48 hours. Last night I was nearly driven nuts and had so many painkillers of polexia because I was in so much pain. But today, it's still there. I have had some polexia, and I have my head on my trusty hot pack because I prefer heat rather than cold, like ice. But I'll talk a little bit more in another video about the surgery and everything, I suppose. But I will say, in recovery, they were giving me fentanyl, and I do sometimes wake up out of anaesthetics crying for no reason. And when they ask what's wrong, I have no clue. But they did give me ketamine, and it was awful. Like, I don't think it was a microdose type thing that they can give people on a PCA machine. So it might have been a larger dose, but I was tripping. Like, I honestly was, it was hell. It was horrible. I thought I was dying. It was terrible. So I don't know whether, I've had that once before and it didn't put me out of it, kind of. It didn't make me trip so much. It was horrible, like having a bloody acid trip. It was shit house. But I'm out. I'm home. And yeah, one of my daughters has COVID, and I'm just hoping I do not catch it for the third time. But I will say farewell for this video. I will probably add a few photos that I took while I was in hospital, and that's it for now. So see you later, champs. Bye. Leave comments, please, and subscribe. Leave comments if you have any questions, if you've been diagnosed with SMA syndrome or gastroparesis or anything like that. I will also add my Instagram account that you can go to and check out. I put posts on there every now and then about chronic illness. But yes, see you later. Blossoms life. Bye.